Hi students, today one important topic for you is Aetcom-module, that is Aetcom, Aetcom-module. According to NMC, we are having competency-based medical education. In this competency medical education, for first year MBBS, we are having Aetcom module, that is Aetcom means Attitude, Ethics and Communication, right? Actually, according to NMC, two sections are there. First section, which consists of Indian medical graduate. So, what are all the qualities or characters they should have? Goals. What are the goals for the Indian medical graduate? What are all the roles and competencies? How skilled they develop their skills, like that. For Indian medical graduate, section 1 is there. Section 2 is actually learning some modules, like for all the 5 years or all the 3, professional 1, professional second year, professional third year, like that they are giving some modules for the Indian medical graduate, that is first year MBBS students. I am going to discuss about the Aetcom module. Actually, we are having 5 modules for first MBBS students. Actually, the teaching hours is 34 hours. So, the first one is, what does it mean to be a doctor? Second one is, what does it mean to be a patient? Third one is DPR, doctor-patient relationship, DPR. The last two is fundamentals of communication and the cadaver as our first teacher. These are all the 5 modules for first year. For anatomy, for physiology, for biochemistry, they are asking each one question in paper 1 and paper 2, both. You are having 6 papers like anatomy 2, physiology 2, biochemistry 2. All the 6 papers having 1 5-mark short notes from these modules. So you should be ready for anatomy, physiology and biochemistry wise questions, right? So these are all the 5 modules. From these 5 modules, they are asking questions. For example, we will discuss in later. For example, they are going to give one clinical scenario. From that clinical scenario, first year Indian medical graduate, that is first year students, what are all the points they should know from the patient? What are all the points they should discuss with the patient? What are all the points they have to observe from the patient? Just observation only, because they don't know anything about clinical scenarios. So, how they are attending the OP, how the doctors giving treatment, how the OP situation and the IP situation is, like that. The students should know about the ambience of the either casualty, emergency medicines, like that. From there, these are all the questions they have to ready for answer. Okay, we will discuss. The third one is definite question for biochemistry. So I am going to briefly discuss about the doctor-patient relationship. Okay. So why we want to go for doctor-patient relationship? That is very, very important. Because nowadays litigations, that is cases against doctors and corporate hospitals and general hospitals are increasing. That is nowadays common for from the public side. Litigations, that is cases against the doctors and hospitals. Not because of the doctor's treatment, admissions or complications, etc., etc. But also patients, they are having actually consumer, they are everything A to Z about the consumer codes. Number 1, they are having eligible knowledge for the cases. Number 2, they expect immediate treatment. After admitting the patient will get cured. Miraculous treatment also sometimes they expect from the doctors, and the miraculous cure also. Third one is, they thought doctors are collecting more amount of fees. Number one. Number two, but no proper treatment. Okay, they thought voluntarily they will go for or producing some complications, then they will go for unnecessary admissions with unnecessary money collection, like that. Next one is, patients died because of the doctor's treatment only. Like that, the patients are, or attenders are, or patients relatives, they thought like that. This is our scenario. Next one is, the lawyers, they are always ready to go for the court or to ask the patient to send the court for both compensation as well as commissions. This is very, very important. If anything happens in any hospitals, one team of lawyers will come for the patient's relatives or patient's attenders and made a discussion, and finally they will go for a court, etc., etc., for commissions and compensations. Finally, not the least, right? No unity from doctor's side. This is big advantage for the society to go for the court and cases, right? So for this scenario, the doctor's patient relationship should be maintained properly. Doctors also do ethical practice, should do ethical practice. Patients also come with the hospital humanity or respect, like that. Okay, then only the relationship, doctor patient relationship should be maintained. Okay.